listened to a seminar about Applied Physiology's Navigator system, which is a cardiovascular clinical decision support system. And we've got three great speakers from America, Britain and Holland who are going to be talking about Navigator. And we're going to hear some interesting case studies of Navigator in use.
So the essence of all monitoring is to be able to allow you to treat your patient. So we should not be talking about monitors at all. We should be talking about treatment. And then the only question we ask is, do I need additional information to treat my patient?
So the first case I'm going to present you today is this one. We were called to see this gentleman in the ward. He was basically 53 years old, 67 kilograms, thinking that maybe there is some room to increase the gradient between the PMS and the CVP. Okay? So now that you've seen this, same situation as before, but with the screen of the Navigator, what would you do? Probably a bit of more people would give fluids, and then still a lot of people thinking about inotrope.
I'm really delighted with how it went. It was terrific presentations and great feedback and interaction from the audience. Lots of debate, quite lively debate, but I think that was a good thing. We demonstrated in quite a few cases how the information with Navigator made this audience at least change their decision on the treatment for the patient, which is what we wanted to show. And we certainly showed how the added variables in Navigator really do make a difference along with its visual display.
Well, I think it was a very interesting discussion. Actually, I think we were allowed to have 1 hour, and we overran for another hour, so we had 2 hours of interactive case-based discussion.
The meeting today was interesting because it allowed us to see how our understood management and philosophy of cardiovascular physiology, which has constantly been compromised by our inability to measure the effect of circulating blood volume and cardiac power. When these numbers are being able to be displayed in front of you in the cases that were done, non-ambiguously you saw the appropriate management, whereas beforehand you would default back to the simple thing of giving more volume, giving a vasopressor and an inotrope. It'll be interesting to see if using Navigator we will actually improve patient outcome. But one thing is for sure, we'll be doing it more efficiently.